Yeah, no, you're right. So that, there are, you also have to have accountability,
Hello, Team Sharon. Good morning, good afternoon, good night, depending on what time you're gonna watch this video. It's another beautiful morning here in Nairobi, Kenya. So excited that it's a holiday. At least we have a long, we're enjoying our long weekend here in Kenya. But all in all, yeah, we thank God for a beautiful new week. We thank God for a beautiful new day. Yes, so your girl is up already. It's around 9. Yeah, I have my appointment, like I mentioned in my previous video. I have my appointment with the doctor. So I'm actually on my way to the hospital to go see the doctor. My appointment is slotted at 9, and it's like 5 minutes to 9. I'm so worried. I'm already late. I'm just crossing fingers I don't get daktari with another patient, because if I do, that will mean I'll have to wait for another whole hour. Yeah, because for the doctor does physios and the lymphatic drainage. So if she handles a patient, it's a clean 1 hour, but my slot was for 9, so I'm hoping that I won't get that she has someone else. And the good thing is that today there is no traffic because it's a holiday, so in no time I'll be there. So how are you? I hope everything is all right wherever you guys are, and you're doing fine. So keep it locked and just get to see how my day is. Today is a holiday, so you can see the way the roads are clear. So the roundabout at University Way has been closed. So since I'm going to Parklands, we are forced to use the other route. That's the other side, like the road that goes to Ngara. So that's why we took that turn, and I'm very lucky it's a holiday, because I'm just thinking if it was a weekday, the madness in traffic that would have been there. Luckily, there's no traffic at all since it's a holiday, and best believe tomorrow is going to be chaotic because guys will be going back to work and that roundabout has been closed. So those in Nairobi, take caution on that road as well, and the roundabout. I'm almost getting to the hospital. It's based on that Parklands Avenue. Yeah, so I've seen Doc has already sent a message that she's already there. Really sad that I'm late, but it's just with 10 minutes anyway. I'll be there. And the beautiful thing is that at least there's no traffic today. Otherwise, I would have really suffered. So we are here already in Parklands, heading to the location where Doc is based. So here I am. This is the building where Doc is based. DRV Center. So get in. Here we are on 9th floor. This is the room where all the magic happens, the physio, the lymphatic drainage. So this is where I'm gonna be. Someone thinks it's really easy to do it.
I know. And that's when, you know, I did a talk at Faraja,
Yeah.
and I was they were saying, well, how can we, so there were a couple of carers
Yeah.
who wanted to learn how to do it. And I'm like, I can't just teach you
Yeah.
in a talk, you know, like we're talking about how to manage lymphedema, and then I just thought, oh, you know what, I'll just show you roughly what it should look like,
Yeah.
hoping that they weren't going to go and just practice on people. Because the other thing is you have to know who not to do it on, or which parts of the body not, like there are different techniques.
Mm-hmm.
So if you'd had like a neck dissection as well, I couldn't take it up to the neck, I have to take it away from the neck to the other side of the neck.
Ah.
Because otherwise if I push it to a place where there aren't any lymph nodes,
Uh-huh.
I'm going to make the problem worse, because it's got nowhere to go.
Oh.
So then your arm will fill up more.
Oh, so if someone might just assume you're just doing like a massage, but you know exactly where you're directing everything.
Yeah, you have to, there's lots of different kind of, I guess you call them routines, yeah. Like if you'd had a double mastectomy, say, in bilateral arm
Yeah.
lymphedema,
Mm-hmm.
maybe and a neck dissection,
Mm-hmm.
I would have to take all your fluid down to your groin, if that was
Ah,
okay at hand being operated on.
So when you start with the neck, why do you start with the neck and not go straight to the
So
arm?
with the theory behind this is that you empty the lymph nodes that are nearest to the heart first,
Okay.
yeah?
Okay.
So you empty the fluid back into the heart,
Mm-hmm.
because that's where it's going to end.
Mm-hmm.
And then the armpit to the neck, then the elbow to the armpit, then the hand to the elbow, yeah?
Okay.
So you empty one place,
Mm-hmm.
so then you can fill it from the place below,
Oh, okay.
and then you move it up.
Ah.
So you go, so this one you empty, then I move this up to here, and I
Mhm.
move up this up to here.
Ah, okay.
Once this is empty, I can
Mhm.
move this up and this up.
Oh, okay.
Yeah. Can you make sense?
So I can just wake up one morning and be like, I saw her doing this. Now I get it. Yeah, because even in you remember I told you I was in the call when you were at Faraja.
Mm-hmm.
So it's just like when you're trying to show people. So I remember someone in the audience asked like if you could please show us how to do it.
And that was a carer.
Yeah.
Which makes sense, but
Yeah.
you just can't.
Now I totally understand, because
It's-
the main reason why I joined, I just wanted to see like how do you, like how in case it happens, what can I do? But when you explained it, I was just like, how come? Why doesn't she want to show us?
And also if somebody's in heart failure, if they're in kidney failure,
Yeah.
you know, you can overload their kidneys and their heart and
Yeah.
really cause them problems, because this fluid is sat in your, say, your arms or your legs,
Yeah.
and now I'm pushing it back to the heart.
Yeah.
And if the heart or the kidneys are
Mhm.
overloaded,
Mm-hmm.
I'm pushing more fluid to them, they're going to struggle even more.
That's
Yeah.
true.
So some people you can't do it on,
Ah.
even if they have lymphedema.
Oh, wow.
Yeah, so yeah, there's all the medical side as well. And you know, and you don't want to feel mean, but
Mhm.
you know, sometimes a little information is harmful.
Yeah.
I'll always teach patients,
Mm-hmm.
but I'm not teaching carers. Unless if I was a certified trainer
Mm-hmm.
and they came to a proper course and
Yeah.
training,
Yeah.
then that's fine, yeah?
Yeah.
Because you teach somebody how to assess who to treat, not to treat,
Yeah.
different conditions, how
Mhm.
you treat.
Mm-hmm.
Yeah,
I get it.
it's to keep patients safe.
That's important. Very
Yeah.
important.
And also if you were to have an infection,
Mm-hmm.
a proper infection, not just
Yeah.
sometimes you can look like you have an infection,
Mm-hmm.
like a small cellulitis.
Yeah.
It looks like cellulitis, but it's not actually an infection because your CRP level isn't raised on a blood test. That's the only way to test if you have a proper infection.
Mm-hmm.
So if you have a diagnosed infection,
Yeah.
I can't do the lymphatic drainage on you because I can spread it.
Ah,
Yeah.
okay. It's just that people, some of these diagnoses, they're quite expensive to treat. So families, caregivers, they when they get things that they can try and save money with,
Absolutely.
yeah, so they feel
Absolutely.
like, oh, it's just like a massage this we can do, but you don't know what can go wrong.
Exactly.
Yeah, it can.
And
cause
ignorance
worse.
is bliss, because then you go
Exactly.
along and you think you're helping and you can make a bit of money
know.
out of it, but actually,
Yeah,
okay, some people you can help, but
Yeah.
it's those ones who you could really make worse.
yeah.
That's the
Because
danger.
when I went to see Dr. Marek, he was just like, please go to this lady because not everyone can do it, and we don't want to get into more problems. So I was just curious, what is Marek talking about?
Yeah.
What does he mean? But now after your explanation, I get it. Yeah.
So you often find, so if we're talking about women like yourself who've got lymphedema,
Yeah.
and they've been to physios or other practitioners who have done the really hard massage to try and squeeze the fluid out, and that makes it either it doesn't get better,
Yeah.
there's no change, or it gets worse. Because what happens if you make even the skin red, it's showing that you're increasing blood flow, and the lymph system is separate to your blood system. But your blood supply produces lymph. So if you increase the blood flow a lot, like through heavy weights, a lot of exercise, certain types of exercise for different people,
Yeah.
the swelling gets worse. It produces more lymph fluid. And if your system can't cope with the lymph
Yeah.
fluid that you have already, you get your lymphedema. Yeah, so that's why, the right massage is like essential. Yeah.
Yeah, it's making more sense now.
And then also, the right compression is so important. And like I've said to quite a few women actually, and actually men, but it's predominantly women, I just said, it's better not to have a stocking than to have an ill-fitting stocking,
Yeah.
because you can make your lymphedema much worse if
You
it's
have
too
the-
tight, And I think what happens is, in a lot of these places that provide stockings here, they don't always have the size range for people, but also the shape. You know how we were talking before, how
Yeah.
we're very different shapes in different countries. We're actually different shapes. Like the Italians can have very slim feet, have
Yeah.
beautiful shoes that fit their feet beautifully, but my foot, I can't fit into Italian shoes because my feet are much wider.
Yeah.
Yeah, and most people in UK will be straight arm compared to in African countries we have better shape, not better shape, but a different shape.
Yeah.
So to fit in, the stockings off the shelf here, made by companies that have made the sleeve to fit the Caucasian straight shape,
Yeah.
it won't fit you, your shape necessarily. So that's, there are lots of factors to it, but I think now that there are more physios training
Yeah.
to give more patients advice and proper advice and proper measurement of stockings is all the way forward. And empowering patients, if we can inform you as much as possible.
Yeah. The wonderful doctor is known as Dr. Patrina. She's based at TRV Center. So I've seen quite an improvement since she started the lymphatic drainage. This is my second session. So I have one more to go. Then we're going to do the measurements and see and know the way forward after this. So that's it, done with today's session. The next session will be on Friday. Then we can she'll get the measurements for the arm as she mentioned, so that we just see the progress for it. But so far so good. There's an improvement. At least the swelling is going down and down. So come Friday we'll get to do the measurements and see. Yeah, so that's it for today. I just wanted you guys to come with me and see what I get to do at the hospital. So it's time to go back and run a few errands at home, and and we call it a day. So today's video is just purely that. Thank you very much, guys, for keeping it locked and watching my video. So I'll see you in my next video. So stay blessed and have a beautiful weekend. Not weekend, holiday.